Complete the table with words from A and B opposite. Noun, absence. Adjective, absent. Diminution, diminish. Flaccidity, flaccid. Spasticity, spastic. Wasting, waste. A doctor is giving instructions to a patient during an examination of the model system. Identify what the doctor is assessing in each case. Look at A opposite to help you. Number one, I would like you to relax. I'm just going to move your arm up and down. Muscle tone. Number two, can I see your hands? Muscle bulk or possibly involuntary movements. Number three, now I'm going to straighten your arm out. Try to stop the power. Number four, can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Complete the sentences. Look at A, B, and C opposite and at the table in 27.1 above to help you. Number one, a flaccid hand drops limply to perform a right angle with the wrist. Number two, breast reflexes are reflexes that are stronger than normal. Number three, muscle wasting means the muscle is reduced in bulk. Four, a tic is a form of involuntary movement. Number five, the key is often used to test the Babinski response. Number six, his coordination was poor. He could not perform rapid alternating movements. Seven, a tendon reflex hammer is used to test reflexes. Eight, when something is diminished, it is less than normal. The patient is wrote at A and E in common. When her name is spoken, she opens her eyes, but she does not answer questions or of the instructions. What is her GCS score? GCS score. I open it. To speech, 3. Verbal response, none, 1. Motor response, none, 1. Complete the table with words from A, B, and C opposite and related forms. Verb, cure, noun, cure, adjective, curative. Excess, excision, grow, rough, growing, invade, invasion, invasive. Obstruct, obstruction, obstructive. Palliate, palliation, palliative, palpate, palpation, palpable, spread, spread, spreading, swell, swelling, swollen. The notes below are about the patient described in the opposite. Use them to put the sentences 1 to 9 in the correct order to make the next paragraph of the case report. Use Appendix 2 on page 20 if you need help with the abbreviation. OE, OET, 37.8 Celsius. Smooth, firm, 3 by 4 centimeters mass in our supraclavicular fossa. Notes 1 to 2 centimeters in diameter, palpable in both axillary and inguinal areas. Oropharynx, NAD. Pulse, 100 per minute regular. Blood pressure, 112/66. CBS, NAD, RS, NAD. Abdominal mass palpable 3 centimeters below L costal meridian. CNS, NAD. Number 1, examination of the central nervous system was normal. 6. Number 2, his mouth and throat were normal. 3. Number 3, there was a smooth, firm 3 by 4 centimeter mass in the right supraclavicular fossa. 7. Number 4, his cardiovascular and respiratory systems were normal. 2. 5. On abdominal examination, there was a mass palpable 3 centimeters below the left costal meridian. 8. 6. On examination, his temperature was 37.8 Celsius. 4. 7. There were enlarged lymph nodes in both axillary and inguinal areas. 5. 8. His pulse rate was 100 per minute regular and blood pressure 112/66. 1. Complete the sentences. Look at A, B, and C opposite to help you. Number 1, distant spread of tumor cells is known as metastasis. Number 2, many symptoms of cancer, such as difficulty swallowing, are due to obstruction. Number 3, the opposite of painful is painless. Number 4, a malignant neoplasm is called a cancer. Number 5, tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. Number 7, if a cure is not possible, palliative treatment should be given. 8, a palpable liver suggests metastasis. Complete the sentences. Look at A, B, and C opposite to help you. Number 1, a baby that is born a week before the EDD is premature. Number 2, a termination of pregnancy may be necessary for medical reasons. Number 3, the first 3 months of pregnancy are known as the first trimester. Number 4, fetal distress in the first stage of labor is an indication of caesarean section. Number 5, it was a rich presentation and delivery was by forceps. 6, a miscarriage is another term for a spontaneous abortion. Number 7, the umbilical cord was wound tightly around the baby's neck and it was unfortunately stillborn. Complete the table with words from A opposite. Verb, abort, noun, abortion. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation. Terminate, termination. Dr. Bennett, an SHO, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The first baby presented as a branch and was delivered by caesarean section.